All right, let's dive into the high-stakes world of medical technology, or MedTech. It's a field packed with brilliant minds and innovations that can literally change lives. But you know what? It's also a graveyard for incredible projects that just never made it. Today, we're going to unpack a framework designed to help you navigate this really complex landscape, and honestly, to just dramatically increase your odds of success.
So here's a wild fact that trips up so many innovators. You can have the most sophisticated algorithm, the most groundbreaking piece of hardware, but that's not actually what determines if you're going to succeed or fail. The real battle, it isn't fought in the lab, it's somewhere else entirely.
And this right here, this gets to the absolute heart of the problem. See, the biggest hurdle isn't building the thing. It's getting doctors and hospitals and the entire healthcare system to actually use the thing. That's the adoption gap, and it's a black hole where millions of dollars and countless hours just disappear.
So in this first part, we're going to take a much closer look at this adoption gap. What does it actually look like on the ground, and why is it so incredibly expensive to get wrong?
I mean, just look at the numbers. The cost of getting this wrong is staggering. We're talking about launches that can lose over €1 million right out of the gate. Money just gets burned on trial and error that was totally avoidable. Projects get stuck in what I call pilot purgatory forever and never scale, and teams get completely tangled up in regulatory red tape. This isn't just a product failing, it's the massive strategic cost of not understanding the world you're trying to step into. Okay, so if the problem is this huge, costly adoption gap, what's the solution, right? How do you even begin to chart a course through all those dangers? Well, let's look at the framework designed for this exact challenge, the StarMap. The StarMap was developed by Dr. Amal Hofkich, the founder of EvoMed Consulting. And his background is really the key here. He's a clinically active physician who has also helped his clients secure millions in venture funding. So he lives right at that intersection of medicine and business. He has seen firsthand why brilliant products just fail to connect with clinical reality. So what is the StarMap? Think of it like a GPS for your medtech idea. It's a strategic system that basically plots your position against 7 critical success factors. It doesn't just show you where you are now. It shines a light on your strengths. It reveals those hidden risks you didn't see coming, and it gives you a clear data-backed roadmap to actually scale successfully. This is such a crucial point. Investing in a framework like this isn't an expense, it's insurance. It's the guidance that helps you avoid those catastrophic mistakes we were just talking about. It's all about recognizing that the price of strategic failure is always higher than the cost of getting it right from the very beginning. Okay, now we get to the core of this whole thing. The StarMap is built around these 7 constellation points. So let's break down what these 7 make-or-break areas are that really determine if a medtech innovation is going to thrive or just completely dive in the real world. The first 4 points are all about how your product fits into the system. First up, specialization. You can't be everything to everyone. Your product has to solve one specific, really urgent problem for a very targeted group of people. Second is predictability. Your tech has to make a doctor's life easier, not more chaotic. It has to fit into their existing workflow almost invisibly. Third, ambulantization. This just means designing for a future where more care happens outside the hospital, in clinics or even at home. Is your tech built for that shift? And finally, ecosystem fit. This one is a giant. If your tool can't talk to the hospital's electronic health records and other systems, it is a non-starter. The final 3 points, they focus on the market and the real-world implementation. Number 5 is economic viability. Can the hospital actually afford your product? And even more importantly, will they get reimbursed for using it? If you can't show a clear return on investment, you're not getting a sale. 6th is quality of care. This is where you show your proof. You have to be able to demonstrate with data that you are improving patient outcomes and safety. And last, number 7 is implementation friction. How hard is it to get your product up and running? If it requires a massive IT overhaul and weeks of staff training, you're facing a huge uphill battle for adoption. Now, theory's great, but let's see how this actually works in practice. We're going to look at a real-world case study where these exact principles were applied to build a really successful product, the CareView dashboard. So meet CareView by Eterno. It's an AI-powered dashboard that's designed to be the central command center for medical practice. It pulls together appointments, patient data, all the communication, and billing into one single, smart, unified view. And this slide right here shows you the magic of the StarMap in action. This isn't a happy accident. It was built this way by design. You can literally draw a straight line from the StarMap principles to CareView's features.
That predictability principle, that's the real-time dashboard, making workflows smooth. Ecosystem fit, it's achieved by integrating every communication channel. Economic viability is baked right in with direct access to billing data. And that whole idea of reduced implementation friction, that's the core benefit of a central dashboard. It simplifies everything, which makes it so much easier to adopt.
And here's the ultimate proof. This is a quote from Bettina Gerner, the Chief Data Officer at Eterno, the company that made CareView. Her words highlight that exact bridge that Dr. Hovkit and the StarMap provide. It's all about bringing the medical and the business worlds together to create something that actually works for real people in the real world.
So, we've seen the problem, we've seen the framework, and we've seen the proof. What's the big takeaway here? How can you start applying this kind of thinking to what you're working on?
The most crucial point is this: your technology alone is not enough. Success in medtech comes from strategic alignment. It's about making sure your product, your business model, and your implementation plan are all perfectly in sync with the messy realities of the healthcare ecosystem. That alignment, that's what unlocks everything else. It unlocks adoption, it unlocks funding, and it unlocks real sustainable growth.
And that brings us to our final question, one for you to really think about. The whole point of the StarMap is to find those hidden risks, those assumptions you're making that might not be true. So take a second and think about your own projects. Where might that critical misalignment be hiding in your strategy? Because finding it now, that's the key to navigating your way to success.